Hello, I'm Stephen Delaney with VisiQuate. I'm here to talk to you today about a large university health system in Southern California. A VisiQuate client since 2018. They have 3 hospitals and over 40 outpatient facilities, including a specialized cancer treatment center and a center of excellence for transplants. Currently, they're seeing $14 million in monthly net yield from using the VisiQuate solutions. Some key success measures observed have been AR days reduced from 63 to 56. Net to 90 collection rates increased from 82% to 90%. Daily cash collections increasing from $5.1 million to $5.9 million. Cost to collect reduced from 2.8% of charges to 1.6% of charges. They saw a 62% increase in accounts worked and a denial rate reduction from 22% to 15%. They have VisiQuate platform solutions across the entire revenue cycle, from front to back, including patient access flow, which takes in real-time HL7 data to help improve the financial clearance process prior to the patient arriving for their services, all the way to self-pay flow on the back end, which manages patient statements, payment plans, and charity evaluation. We take in data from Cerner, PBAR, MS4, HDM, and Thrive and Assurance. I want to talk to you about the experiences that they've had using our collection flow application. In this first set of charts, we're going to look at results from the commercial collection team. So look at the top graph. The top graph shows that in January of 2019, this team worked 9,810 accounts. Follow that all the way through to December of 2020, and the team worked 15,892 accounts. Now that is a 62% increase in number of accounts worked by the team. Let's look at a few more statistics. This third chart down shows us that the team more or less remained constant, starting at 21 people, going to a high of 28 people, and then now back down to 25 people. But now let's break that down to accounts worked on a per employee basis. In January of 2019, they worked 467 accounts per person. Follow that through to December 2020, and now they're working 636 accounts per person. That is a 36% increase in the number of accounts each person works on this team. So what this allowed our client to do was to, number one, avoid hiring additional people to work a significantly higher volume of accounts. And number two, it allowed this client to insource the collection of accounts that were previously outsourced to an outside vendor. Now this is great results here and great increase in productivity, but let's look at what does that mean for the bottom line for their business office. And now let's take a look at the top chart. The top chart is the net to 90 collection rate. This client has a goal of collecting 90% of expected revenue within 90 days of discharge. So they went from 82.7% in January of 2019 to 89.8% in November of 2020. That is a 7.1% increase in cash. That is cash in the door. The next chart, they went from a gross denial rate of 22% to a denial rate of 15%. So more cash is coming in the door, less claims are getting denied. The bottom chart, cost to collect. They reduced the cost to collect from 2.8% of charges to 1.6% of charges. Again, a significant reduction due to the fact that their staff is much more efficient and much more productive through the use of our collection flow application.